Hi, my name is Diana Valentine, and today I will be presenting a PowerPoint on my research project. The topic of my research project was called The Importance of Effective Communication Strategies in Antepartum, Labor, and Postpartum Care. My thesis assignment was implementing effective communication strategies is essential in antepartum, labor, and postpartum care to help improve women's birth experiences, self-awareness, and emotional support. The topic of my first article that I researched was called Strategies to Improve Communication in Maternal and Newborn Care. And they researched how communication can help improve the relationship between healthcare workers, women, their family members, and their partners from beginning to end, so from antepartum to postpartum. And so this article really focused on communication and, like I said, all throughout the three main stages of pregnancy. And so they found that using effective communication strategies that they suggest helps improve maternal experiences and outcomes. And so some of their suggestions were how to incorporate these new communication strategies through training or by furthering education for healthcare workers to help build and strengthen their care, as well as strengthen their communication between their patients and the diverse cultures and ethnicities that they may encounter. And so one aspect of this article that I really enjoyed reading about and seeing was how they prioritize building trust with your patients, because it makes such a huge difference for you and for them, and how they react and engage while they're under your care. And so I think especially with working in labor and delivery, building that trust is so important, and it's so important to take care of it, and because once you lose it, it can be very hard to get it back. And so some things that they suggest or they found was that it's important to provide emotional support during pregnancy. I mean, all throughout stages, but especially during pregnancy, because there's lots of things going on, lots of changes. And then, of course, using clear communication from pregnancy to labor to postpartum, but especially during labor, it's very important that you're very clear with your patients and you let them know what's going on as much as you can, and be very just open and clear and have that open communication with them. And then, like I said, building trust and building that interpersonal relationship with them. And then, of course, encouraging the participation of their partner or their family members as much as the woman allow them to. That can make a really huge difference in their birthing experience. The second article that I researched, their topic was communication trainings to improve birth experiences. And so they focus on how empathetic communication training could provide a more holistic approach to improve women's perspectives on childbirth and their experiences with childbirth. And so they found that empathetic communication training for healthcare workers helps provide a more positive birthing experience for women. It allows for a good explanation and proper education, as well as awareness for these women, and it sets more realistic expectations about the process of what childbirth may look like for them. But then again, childbirth is so unpredictable that there's only so much we can educate beforehand, because at the moment things can change very quickly. And so as long as you're having, again, that very clear communication about what's happening with your patient, or explaining things, walking through the process if you can at that time to explain them to them, can make a huge difference in their birthing experience. As well as with a positive birthing experience can also help improve psychosocial control, especially during the postpartum period. And so it can help having a positive childbirth experience can transfer over and can also have a good postpartum period, but it really just depends on on the woman. But researchers, through their research, found that empathetic communication had greater, with empathetic communication, had greater satisfaction scores with the birthing experience. And so having that very empathetic and active listening communication can really make a huge difference in these women's experiences, especially during childbirth. The third article I researched was communication between healthcare workers and laboring women. And so this article's research question was, does communication interventions improve interactions between healthcare providers and laboring women? And so they reviewed multiple databases, and interestingly enough, they found very limited evidence to support their research question, but they were able to conclude that communication training does show a positive outcome in women's birthing experiences. And so I found it very interesting that there's still a lack of evidence about this, but research still strongly suggests that communication training for healthcare workers can still provide a positive and holistic birthing experience for a woman, and it allows them to feel a little bit more comfortable. And as women, they might feel more, if they're having this open communication, it can help them feel more respected, make them feel like their concerns are being acknowledged and they're being supported and they're being heard. And just having that involvement of them, of their own care, can make a huge difference in their laboring experience. In conclusion, through my research, it is very clear that it strongly suggests that effective communication is essential in pregnancy and labor and postpartum care. And so all three articles found that effective communication strategies such as education, emotional support, empathetic interactions, allowing them to make decisions, feeling autonomy, feeling empowerment, being able to be active participants of their care, can overall improve women's experiences. And it was very interesting, and I'm very glad that all the results geared to just focusing on women's experience during pregnancy, labor, and postpartum, because it's very easy to compare and contrast one pregnancy with the other, but no pregnancy is the same, no labor is the same. And so I'm very glad that all the research suggests to just core communication and making it such an important skill in healthcare. So some interesting observations I found while conducting my research was, at its core, communication is essential in healthcare, but specifically for women who are experiencing pregnancy, who are experiencing labor, and who are experiencing postpartum. Communication at its core can help bring a positive experience to their story. And it was very interesting that one way or the other, all the articles emphasize that empathy, continuing education, providing emotional support, providing autonomy, decision making, all can help produce a positive childbirth experience for many of these women. Each child is different, each pregnancy is different, each laboring experience is different and unique to every single pregnancy, every single woman. No pregnancy is the same. And so I think helping them in that time of need where there's high anxiety, lots of feelings, high intensity, high stress, and being there to support them and their decisions can make a very, very meaningful impact and a meaningful experience for each of these women. Another thing is having a continuous communication loop between the patient and the providers is extremely important, because as nurses, you're always kind of like the mediator, especially at hospitals when providers are not always there. And so helping everybody stay in the same loop and keeping the provider informed about any questions that the patient has or what's the next steps, or keeping the patient informed about like, hey, the provider is coming in so and so time, you're like, let's do this and this before they get here, anything that keeps them informed, both the patient and the provider, just can all keep everybody in the same loop and help provide positive experiences for these women. And just keeping them informed about what's happening can also make a huge difference. And finally, how I plan to apply all the information that I've learned to my daily care or through my job is, especially antepartum, being very clear about providing education. So there's lots of questions, lots of anxiety, lots of what ifs, and just providing information for these women is going to make such a huge difference, helping them be aware about, like I said, the changes that are going to happen, things to expect at the hospital can all make a very impactful experience. And so then also having them encouraging to ask questions, encouraging to follow up with their providers in case they have more questions, or having them be active participants of their pregnancy, and having them be well informed of like, hey, what's gonna happen, what to expect, this and this is happening, is all gonna be make a more meaningful birthing experience. And so moving on to labor and delivery, I think one of the biggest things that a lot of women seek is just being able to have their wishes met as much as they can. So allowing decision making, especially allowing just respect and kindness, empathetic listening, autonomy, all make a very, very huge difference in their birthing experience. And of course, communicating all throughout the entire process from beginning to end, and even beyond that, because we give postpartum education teaching. And so with that, being able to making sure that they are understanding what to do, how to do it, the resources available, doing teach back methods, helping them, like I said, with resources, providing emotional support, lots and lots of reassurance, especially during this time of exhaustion and happiness and feeling tired. And so communicating all throughout the stages of pregnancy is going to make such a huge difference. And I'm very excited to kind of use these methods that I've come to learn and understand to kind of make an impact, and hopefully make an impact in these women's lives and their birthing experiences. And these are my references, and I thank you for your time.